Go Ellsworth, brought to you by these proud community sponsors. Anita Hoffines, Dr. Mark Herzog,
Hi, this is Carol Kratzer, Director of the Ellsworth-Kanopolis Area Chamber of Commerce, and we are on Eagle TV today with our Ellsworth Connection. And today in our Did You Know segment, we have Beth Vallier, good morning, with the Ellsworth County Medical Center. And today we're going to learn about all the great things that our medical center brings to Ellsworth. How are you this morning?
I'm doing fine, thank you,
Great.
Carol.
Ellsworth has been very lucky. We have had a hospital for a long time. You want to bring us up on a little bit of the history of the Ellsworth Hospital?
Sure. The hospital has been in existence for over 116 years, so you're right. We have been here a long time. A wonderful establishment that was started by Doctors Harry Heisem and Harry O'Donnell. A long time ago, and they envisioned Ellsworth County Medical Center being a wonderful resource for all of the people in the area, and it has been that for a long time. We moved into our current location quite a few years ago, but as you can see, we take excellent care of this facility, and as people walk in, they think it's a lot younger than what it actually is.
Which is nice, because hospitals, you know, can get old quickly with as much service as they put in.
Absolutely, and we've tried hard to make sure that our diagnostic services especially are very state-of-the-art, very up-to-date, and so we are continually improving our processes around here, our equipment, and we've had a lot of friends that have helped us over the years accomplish that feat.
And we'll be talking about one of those friends later in our interview, and that's the Hospital Auxiliary, which really is a great organization that helps a lot.
Yes.
Speaking of some of the improvements that you've done, let's go there first before we talk about services. There have been quite a few changes in the last year in healthcare itself, but in what you guys have stepped up to make it better for us, the consumer. You want to tell us about some of that?
Absolutely. It wasn't too long after this current facility was built that we again began adding on, and so we added on a CT suite for CAT scan, and that is used abundantly. It's just always in use. So we appreciate that. And then we added on the rural health clinic, and that brought together several practices, several medical practices together under one roof, so it would be very convenient for patients, and the access to the hospital and our services would be strengthened. Also, at that point, they added on a wellness center, and so physical therapy, cardiac rehab, occupational therapy moved into that area, as well as making it available for our general community to have a great place to exercise 24/7. 365 days a year.
And that's wonderful with our climate the way it is.
Right. I think the next newest addition was our outpatient services area. In order to build that, we had to acquire another place for all of our health information services, financial services, administration, etc. So we were able to secure a building directly north of this campus. That was an old manufacturing building. We took over part of that. It is now owned by the Ellsworth Healthcare Foundation. And that building serves now to house all those departments. We took over the space then for outpatient services because we were just bursting at the seams, and that had to be done.
That's a lovely problem to have, though.
Yeah, it is, I suppose. And so now we have over 11 different specialty clinics that use that facility, as well as we are just now starting our telemedicine services, and that is also housed in the outpatient services area. And telemedicine is an incredible opportunity for the folks in the area to utilize. Probably the next and most recent addition was just about a year ago. We added on our friends and family room. This is like a hospice or palliative care room that is at times used in that way. And that was helped, we were helped by the Friends of Hospice Foundation that gave us some monies to build that room and reconstruct it. So that room is widely used. It's kind of the favored room, not always for palliative care, but if you have an opportunity to stay in that room, we sure encourage people to use it. And then at the same time, we remodeled all of our patient rooms with new furnishings and beds and curtains and wall coverings, etc. So they're very, very nice rooms.
And then we were talking earlier before we started the interview, and you said something about VA appointments here at the hospital, so people don't have to travel. You want to explain that a little bit?
That kind of goes hand in glove with some of the telemedicine opportunities that are coming about. But the Veterans Administration has opened up the door for our local veterans to come here to get their services. They will still have to get approval from the VA, as they always have, and I think they're going to give out a special card, is my understanding. But irregardless, veterans can come here to get their appointments and save that travel and that distance to Hayes or Wichita or wherever.
And who would they talk to about that?
They first need to get that secured through the VA administration.
Perfect, perfect. We were talking a little bit earlier about some of the services besides what you've improved here, but you have doctors that come in, and there are some services that people don't realize they can actually have done here at the hospital than having to go to Salina or Hayes or Wichita to get done. Do you want to explain some of those things?
I think immediately of radiology, because I've had people say, oh, I can get a mammography there at Ellsworth, and yes, you can. We have a digital mammography mobile service that comes right here to our door. So mammography, also nuclear medicine, and MRIs are all done here at Ellsworth County Medical Center, as well as CAT scans, ultrasounds, regular bone density, or x-rays are all performed here. Our laboratory services have some of the best equipment around, and they are able to do what most little hospitals or rural hospitals can't do, just because of the technology that we have invested in.
And that just helps us so far, because it's, you know, it's a drag to have to go all the way into Salina. And I mean, it's not all the way, but you know what I mean.
Yes.
You know, it's 45 minutes there and 45 minutes back, and sometimes those tests take, you know, 10 minutes. So you're sitting there.
Yes.
It takes longer to get there than it does to do the test.
Right. And we have a lot of specialists coming to our door. As you mentioned, we have cardiologists, dermatology now is being done through telemedicine, which is amazing. Professional hearing clinic, gastroenterology clinics, foot doctors, oncology is another telemedicine clinic that we are just now starting. Orthopedic clinic, nephrology, OB/GYN, pediatric care, pain clinic, and the list just goes on and on as we continue to add services. I believe the very next one coming on board will be from Central Kansas Mental Health, doing counseling services right here at the clinic.
Wonderful.
So,
wonderful. Now, is there anything that maybe the hospital or the clinic covers that the general public doesn't know about?
Besides everything I just listed.
Yes, besides everything you just listed.
Well, I can tell you we have a brand new medical doctor on board, and not everyone might know Dr. Katie McWilliams. She's kind of our homegrown
Yes, she is. That's so wonderful.
Doctor. And we helped her all the way through medical school, all the way through her residency program, and we are ecstatic to have her back on staff and here practicing with our other two medical doctors. We have an internal medicine doctor, and that's something that not a lot of people know, that Dr. Slumka is an internal medicine doctor. So he can perform the stress test and do some other diagnostic work that most family practitioners cannot. And then we have, of course, Dr. Ron Whitmer, who is a doctor of osteopath. So he also brings, along with Dr. McWilliams, some unique aspects of family care.
We really are very, very lucky in this small community to have such a well-rounded medical staff that we can just get just about everything covered. It's wonderful.
Right, right.
Anything else you want to just tell us?
Well, I was thinking also about our cardiac rehab program. One of our local cardiologist spoke about our cardiac rehab program as being one of the best in the state of Kansas.
Wow.
So that was a high compliment, and we appreciate him. We do have a terrific program, and I know that right now they are the busiest. They've had one of the busiest months that they have had in the history of cardiac rehab. And I'm sorry for the patients that are having to endure that, and we don't want that for anyone. But if you need those services, this is the place to come.
Well, and it's close to home, so you don't have the travel fatigue that you would have if you had to go somewhere else. So that's wonderful.
Absolutely.
Well, we do have one of the best hospitals and medical centers in the state, close to home, with a lot of things that we can do. And we will have the number at the bottom of the screen if you have any more questions of people you can ask. This is Carol Kratzer with Beth Vallier. Thank you so much for being with us today.
Thank you.
And this is everything you need to know about Ellsworth County Medical Center.
At Eagle Communications,
we bring you the best
in high-speed internet,
digital television,
and reliable telephone service,
so you can enjoy
the latest technology
for your busy life.
We're 100% employee-owned.
When you're talking to one of us,
you are talking to an owner.
You can rest assured
that we're working hard
to bring you the best value for your money.
Because our bottom line
is making sure we exceed your bottom line.
Eagle Communications.
Our community connected.
Hi, this is Carol Kratzer with the Ellsworth-Kanopolis Area Chamber of Commerce, back at you with our community connection. And today we're going to be talking about the Ellsworth County Medical Center's auxiliary. And this is a wonderful group of ladies, mostly, that have done some great work for our community and for our hospital. And Beth is back with us. Thank you, Beth.
Sure.
And tell me a little bit about the hospital auxiliary. What is it?
The auxiliary is a group, as you said, mostly of ladies, but we have some wonderful guys in there too, that has been around for many, many years. It's probably the largest and the oldest organization in Ellsworth County as far as an auxiliary goes. And these folks are committed to providing support for the medical center in the way of services, hosting events for us, and providing some fundraising so that they can provide scholarships, magazine subscriptions, equipment, furniture, whatever our need is, they step up to the plate and they try so hard to meet that need.
That's wonderful. And we are running into a little problem with our auxiliary right now. Our auxiliary is aging. I don't want to say they're old, but they are aging, and we need some young blood to help.
Sure.
And it's very easy to become a member, and you don't have to attend all the meetings.
Right.
You just have to be willing to help when they say, hey, we need something.
That's right.
And how do we become a member?
Well, it is, as you said, very easy to become a member. We've tried to make it even easier this year. If you go to Jean's IGA or the Steakhouse, Payton's, or many other locations in town, you'll see a nice little box right by the cash register. And you can pull out a little slip there that's a registration form, add $5 to it, tuck it back in the box, we'll pick it up, and you are a member. You're right, you don't need to come to all the meetings. If you would like to become a member, you can simply go to our website, www.ewmed.com, and I'm sure that'll be on the bottom of the screen too. Click on About ECMC and then the auxiliary page, and there you go again. You can easily become a member through that page. We can just even a phone call and let us know that you would like to become a member. We'll take care of the details for you. So
this is our call, people. We need you.
Yes.
And we all have something to give, whether it's making a teddy bear at home or cooking a batch of cookies for one of their programs, or being available for the Jingle Bell Shop and Sell thing. There's lots that you can do for us.
Right. We have a lot of things that we do as an auxiliary. I've been an auxiliary member since I moved to Ellsworth 9 years ago. We do have, as I mentioned, magazine subscriptions. So if you've sat in one of our lobbies, maybe waiting for a few minutes for a doctor's appointment or for a lab test result, know that that magazine you pick up was probably purchased by the auxiliary. We have students that are in college right now, and many that have graduated from nursing school or from a lab tech school, wherever, that have received auxiliary scholarships. And those scholarships, the new ones, are coming due October 1st. So if somebody is interested in getting a scholarship, they can simply contact me here at the hospital. I'll be happy to help them do that, or again through our website. The phlebotomy chair down in Laboratory Services was purchased with auxiliary monies. The radiology has a very unique piece of equipment called a pigostat. It's
I saw that.
Weird name, but it helps in so many ways when we have a little baby or a toddler that's wormy and squirmy and it's hard to get that picture just right. They slip them into the pigostat contraption, I'll call it, the equipment, and it helps to restrain that child in a safe way so they can quickly snap that picture and avoid any extra radiation to any of the techs or anyone else that's helping with that endeavor. We have teddy bears, as you mentioned, that are made, and the children coming into the ER, as you can imagine, their little hearts are thumping hard because they're scared. It's a new environment. Having something soft and cuddly to hold on to, it provides such comfort to that child. So the folks in the auxiliary sew all the time, keeping us stocked with teddy bears. We also have provided equipment. I think the most recent thing was a cardiac monitor piece of equipment that is in our cardiac rehab unit.
Wonderful.
So lots and lots of things.
And I know that they are busy because I've been to a couple of meetings, but they have a big event coming up that's in November. It's a little later in the year this year.
Mm-hmm.
We've moved it back a little bit. It's November 15th this year, but it's an annual event.
Yes.
So, and it's called the Jingle Bell Shop and Sell.
Correct. Yes.
And it is spectacular.
It is.
And you have something called Grandma's Attic,
right,
which is where those of us that have treasures that we are no longer treasuring can give or donate, and they become the treasure of someone else. And I've looked at, there's been a few things in there that I've eyed.
Right.
Last year I had a friend who went and bought all the antique egg beaters because she decorated her kitchen with them. And so that helped, her redecorate her kitchen, and it helped, that. And so,
yes, those items are always very reasonably priced, and Grandma's Attic has been a huge success for the auxiliary. People have loved the fact that their treasure is going into someone else's home. So as we all tend to want to downsize, this is a great opportunity to make that donation to the auxiliary. They can simply call Bev Vasco. She's at 785-472-3111, extension 314, and Bev will be happy to help coordinate picking up those items and getting them priced and sold.
And they can do that year-round.
Absolutely, year-round.
So you have a lot of information about the hospital auxiliary, what they do, how they help you, and how they need your help. So become a member today. This is Carol Kratzer with the Community Connection.
Go Ellsworth, brought to you by these proud community sponsors. Anita Hoffines, Dr. Mark Herzog,